My name is Dr. Choi from VS Line Clinic in Apgu, South Korea. Today, I'm really excited and happy to talk about the product from LALA. And the product that I'm going to introduce you today is going to be a LALA Peel. It's an exfoliating facial product that uses Lipo Hydroxy Acid. So I would love to discuss everything that I know to you and that you may need to get interested in. So for example, their benefits and ingredients and usage and their unique brushing techniques that every patient that I know loves about. So basically, our clinic has been using this product, LALA Peel, over 3 years now. And not only in our clinic in Apgujeong, we also have branches in Gangnam and Incheon, and they are all using this product. And many of patients and myself are a big fan of this LALA Peel. They are very safe, effective, and reasonably priced. So every patient love about with using this skin peeling. So let's talk about this product. So before we start and discuss about LALA Peel, I'd love to mainly basically cover why we need this LALA Peel. So as you know, when we are young, our skin has a very thin layers of dead skin cells with tiny little bit of dead skin on the thin epidermis layers. And underneath it, we have thick dermises where has optimal collagen productions are going up. However, as time goes by, those function of the skin collagen production has been reduced, and accumulate those dead skin cells on their surface and cause a thicker epidermis layers on it. So, and with these thickened epidermis and dead skin cells and debris, they could lead to or form an environment for skin troubles or acne and any inflammations. For this matter, so we have made an effort to regenerate the skin by firstly removing those debris and dead skin cells using a variety of methods, and one of them is a chemical. So, however, these chemical products used for these purposes has caused not only the removing of those dead skin cells, but also unwanted skin problems. So, as you may know, there are chemical removers such as AHA, BHA, and I'll just briefly mention about what are they. So AHA is, AHA is a chemical that extracted from natural materials. The very well-known example is glycolic acid. Is a very water-soluble product and is a good for removing dead skin cells while maintaining its skin moistures. However, using high concentration of AHA hydroxy acid can cause skin irritations and make skin very sensitive. So we have to be really careful of using these chemical products. So and the BHA, what's called as a beta hydroxy acid, where the hydroxy chemicals are situated, is different. Cause different functions. So it's a substance with a lipophilic properties that helps to cure acne. So typical example would be salicylic acid. So as many patients begin their take care of their skin and try to start those skincares as because of acne. So BHA is a great help and great start with to try. However, using this incorrectly, such as using the product too much, can cause skin burn and cause more problems than get rid of those acne. So it also needs very good care. So in order to avoid these side effects and those PAHA, so polyhydroxy acid, or LALA, has been developed. These products are designed to remove the layers of the skin, but not everything. So just leave the basis of those the epidermis layer and try to provide antibacterial and anti-inflammatory environment that help to regenerate skin dermis layers. So The AHA has been a great product, but even though they overcome those problems of AHA, so alpha hydroxy acid, but it turned out to be having relatively insignificant effects. So lastly, the Lipo Hydroxy Acid with the alkalis on it, these products have been put into LALA PEEL, the product that I'm going to discuss today, as I've been using to remove all the layers of dead skin cells carefully and very properly. And because if we use the BHA, beta hydroxy acid, that caused sunburns from the UV lights. Using these lipo hydroxy acid has helped keep the skin healthy by just removing only necessary amount of dead skin cells. So therefore, it really helped improving overall skin conditions and promote a healthy skin with the anti-inflammatory and antibacterial environments for epidermis cells. So to overall explain about this LALA PEEL, it consists of 3 main products. And LALA PEEL is a product that can be, so the main like the benefit of using LALA PEEL was it is a very safe product and shows relatively good results, and that's cause of the compositions in LALA PEEL. So there are main 3 things is lipo hydroxy acid and a pisol and a lipid. So lipo hydroxy acid is basically a product to remove those dead skin cells, as I told you before, and pisol is to help and activate the collagen in fibrous tissues, to basically modeling those skin barriers after using those LHA removals of debris on the epidermis layers. And lipid is also in the product to protect those skins from the damaging during those procedures. So basically, all in all, the LALA PEEL has been a unique peeling products that offers the benefit of both AHA and BHA had before, while also incorporate with the lipids to help to protect the skin that we had a problem with the side effects of LAHA and BHA. So it is very gentle, but very effective option for those who have a sensitive skin too, and with a variety of skin troubles. So it can help to overcome those and improve overall skin textures. And next is then how this how we use the LALA PEEL. So if you open the box of LALA PEEL, it consists of 2 bottles. So basically, it has a solution called basic and the other called ultra. It consists of the same ingredient but different concentrations. So basic is lighter, while ultra is stronger. So we can actually use these 2 differences into different conditions. So for patients who wants to receive a light skin care treatment only, then we apply basic first and follow with short time ultra to remove those dead skin cells thoroughly. But for the patients who want intensive care because of the acne or oily skin troubles, we put a little more time with the ultra and try to give them much time they need to get those skin environments. And this is the page that I really want to focus today. This is going to be the main reason that why I love about this product, and this should be the one that you should try. So first of all, LALA PEEL in Korea, it was a very well-known product in South Korea. So as you may all know, the K-beauty or this beauty industry in Korea is a very, very humongous. But among those products, and we have selected a lot of peeling products, but LALA PEEL itself was standing by itself. It had its own marketing power that we really did not need to invest a lot of time and effort to explain everything to the patients. They had advertised a lot like this, like providing a lot of seminars or showing a lot of effort to explain what they are, and show not only on the physicians but to everyone on those patients or customers who would love to take this. So it was not our effort to broadcast this product. It was the patients who just came to our clinic because we just put it on, but we were not advertising that we were good at this, but they just come to it because they just stand for itself. And yeah, it wasn't that famous and it was well known. And I believe one of the other reasons that I really love about this product, but because I am also patients who receive a lot of field occasionally, is they have this philosophy of really taking care of the patients. So one of that can be shown with their unique technique of brushings, so which I love about. So so when patients first come to my clinic and for the clean skincare, they tend to only concentrate on their cares on the faces. However, with the help of LALA PEEL products, LALA PEEL, the patients could receive the care not only on their faces, but they also take care on their scalp or neck lymph areas. So, which provide a greater satisfaction of aftercares. So, LALA PEEL's purity lies not only on its ingredients or its outcome, but it also have broader scope of facial care it provides for the patients. So, who received this treatment felt a lot of satisfactions and great happiness and showed great results out of it. And second of all is stability. I have mentioned before that, as you may know, that as a physician too, sometimes it's much more important to have not. I know the great product should be cause and come with great results, but another thing is it doesn't have to have any unexpected, unwanted side effects. So I know many patients complain about redness or tingling issues or sensations after some of the skin treatments because they have very sensitive skin or very thin epidermis layers, and it can cause it. And we cannot be seen because even though we do a lot of treatment and we see a lot of patient skin, but these are very unexpected and unwanted. So and it is very true, especially for peeling products, that it may exacerbate skins and may cause a lot of unwanted results. So, but in this matter, what I consider LALA PEEL the strongest point is that for us in this regard is it doesn't show a lot of big side effects. Of course, I'll be honest that some of patients may still experience redness or tingleness even using LALA PEEL, but especially during these dry and cold winter seasons that I counsel about this with these products. But however, using enough moisturizers or aftercares with the skin ampoules that really cared and showed a very quick skin recovery. So to be honest, it was very safer method to use because we could really see the any unwanted we can expect those side effects too, and there's a good aftercare of that too. So basically any problems that caused by LALA PEEL was very manageable. So that's very good, the very level thing that I like about this, and it also has really no downtime. So I will show you later on with a video clip how you can readily see the results of LALA PEEL. So many of patients come to my clinic just before like photo shots or graduation party or even weddings, they come to our clinic and ask about, is there any treatments that I can get but has no side effects or no downtime because I have something tomorrow? Then I know it's very difficult for us to help them. But in those situations, I really and very comfortably suggest treat with LALA PEEL because it shows very low downtime and shows very good results out of it. And so that's good, very good benefit of LALA PEEL. And thirdly, this maybe this is another reason why I came here today and tell you about this is we can add this with the combination of treatment. So it can be used with a variety of procedures because in our clinic we have a variety of skincares, treatments, lifting lasers, or even a laser for pigments. But LALA PEEL delivers a greater and excellent results of those combination treatments. So, for example, before a procedure that involves microneedling injections or HIFU lifting procedures, I found is very effective using LALA because once you remove those dead skin cells and allow those better penetration and efficacy of injection solutions, it shows better results. And I did it to myself, and I found a very so much better outcome. So by using LALA PEEL before any of those procedures, we ensure that the skin is more receptible states than any others than not doing it. So allowing for better penetration conditions for it. This could lead more effective and long-lasting results for our patients. And as I mentioned about the stability, so was a very, as I told you, because LALA PEEL is a very safe method, a product of using it. So even though having Ulthera or any lifting lasers or those toning lasers could be combined with LALA PEEL procedures. So it was a very, very good option for us because we could provide better results and show them much more option for their treatments. And lastly, but not least, as always about this price competitiveness. So with those one box, we could treat at least 20 people, and it was a very good marketing for us too. So, and patients felt very reasonable to get these treatment. So it was a very easy for us to suggest and recommend these procedures before any procedures that we do in our clinic. So I felt was a very, very easy way to enter and try on. And so this is a sum up. So in conclusion, LALA PEEL is an excellent exfoliating facial product that I recommend, and it really helped improve skin type or any condition in our in patients. So the one thing that I really could not show with this PPT is this unique brushing technique that I really love about, and so which will be shown in the next slide with video clip, it provided additional benefits such as lymphatic massage and improve the blood circulation, so make the face very glowing after the treatment. And it's really good to use because it's very safe. We suggest to use the regular basis, which really helps reduce these dead skin cell freckles and even acne scars because it makes skin very soft too. So yeah, it really helps with dry skin and any sort of skin type too. So next will be video clip, and I'm really sorry for this. Like I had very short time of reading this, so this has not been translated in English, but I'll explain what it is. and try to show you how it is. So LALA PEEL provide with these their cleanser too. So what they do is they use this their own cleanser too. And if you see those brushes on here in this clip, those brushes are not just typical ones. They are very widely open. So try to show provide a lot of foam bubbles on it, and it's a very soft while it's a soft. Is a very firm too, and is a very strong. Well, because we tried to buy other brushes too with to do this cleansing, but those feathers would fall off, or they were really could not produce this amount of bubbles straight after brushing it. So, and they so they invest not a lot of time and effort on not only on the products but on the brushes and its techniques. Those are the main things that I like of the philosophy too. So basically, they cleanse where on the eyes, on the nose area, and the mouth, and not only there, is everywhere else from to the neck. So basically, the first step is just cleansing, and as you see, they also focus on the neck too. So everywhere, and they also use a little strengths on there. And then after cleans out those cleansers, now we use bases. Basic as just those solutions, but you can see those brush nets, they sector in the 4 sections, and not only divide them in the 4 sectors. They use brushes not on the horizontal, but not only on the vertical ways. They use on the horizontal ways. It's trying to make a lot of touches on brush and the face, so cause more those bubbles, and trying to clean up everywhere, and trying to make sure it touches everywhere they do. So they do thoroughly. The basic and the cleanup. And next is ultra. Ultra we use with the cotton ball too, and you need to have little gentle forces on it. So they do on everywhere on the faces, but it's not because of the brushing. You have to give you a little more soft. And this going to be the technique that I mentioned about. They use on the scalp too. And this is one of the things that our patients love about. We do have other peeling products, but they don't offer, and they don't have anything with these techniques that does what everyone liked about it. And they'll be the most of my presentations. And if you have any questions, please ask me about it. Just start from chat. You could, if you have any question, please give us in those writings. Thank you. No. So yeah, they said there was some problem with those videos. I'm sorry, we had a little difficulty. It was our first time trying this. So if you have any, no. Oh yeah, and we do use this with a lot of other devices. And what I often do is we do use with the needle injections, but I saw none of any complications or side effects doing those needle injections after LALA PEEL. It was very safe, and very effective, and showed much more result, a better result out of it. And we do have used those pigment lasers afterward too, but it was okay too. Contraindications, can I combine them? Invasive, yeah. I don't know how invasive we talked about, but well, needle injections or the fillers of Botox can be fine too. And the contraindications, to be honest, that's another thing good about another great thing about this product is I recommend to most of patients, even with a very oily skins and a lot of people with a lot of strong acne scars and activating acne. Yes, we do recommend them too. It is perfectly safe, and they showed better results out of it. And yes, we did have, as I mentioned, they did have some complications out of it because they felt tingleness or itchiness, or I could saw those redness. But as I mentioned, with a great aftercares, all the side effects were gone. So it was really okay. And yeah, I recommend to do it. Pilmed, so there was another question of Pilmed. I'm sorry, I don't know about those Pilmed billing, so I'll try to look for it. And may I know the overall pH level products pH level is involves a lot of evaluations and how it affects the sensitive. Okay. I'm sorry about the pH level of this. It must be. I think it's alkali. So, but it was very on sensitive skins, how it affects. To be honest, on the sensitive skins, when I say the definition of a sensitive skin is the ones that I think is after treatment, we can actually see side effects out of it. But I saw, as I mentioned, we did have patients with a sensitive skin with the product, but it was generally very okay with using it and had no big side effects out. And we do give them a lot of calming, as you saw in the video clips, it's calming mask too. So it was really okay to overcome any side effects. Oh, okay, there are so many now. Can I? Oh, okay, that's a good question too. Do we use both basic and ultra before the invasive treatment? Yes. In our general procedure, we use both basic and ultra before using for just skin care, but also before any invasive treatment too. We do have those set up treatment time, which is we use a basic for 5 minutes and use 10 minutes on ultra. But yes, those typical setting was okay with any invasive treatment. And for the people with the sensitive skins, or because we do see the patients even though we put them on and just leave them, we just leave the patients with ultra, but we give them those bells if they feel little itchiness or tingling. Just tell us to press the button, so we come and just clean up. And yeah, it's okay to treat them with both products. But if you see a patient, and if you know the patient well, and they had experienced those side effects beforehand, then yes, we took out those ultra or try to minimize those times on smeared on the skin. Yes. Oh yes. Oh, about numbing creams. There was a question about applying a numbing cream too. But yes. To be honest, I am not a big fan of MTS microneedles because you can see those microneedles can cause. What I meant of microneedle injections beforehand was those injections, microneedle injections, not MTS. I had experience with a lot of MTS procedures too, but as you know, those small needles and movements, and while doing that, we have to go around the skin and cause a lot of scars, unseen scars, but they come out later on the procedure. So to be honest, I'm not really fond of MTS procedures, but we combine with any other procedures, lasers, and even liftings and those microneedle injections. So and about non-cream, sorry. So we do put the non-creams after doing a LALA peel because they as I mentioned, using a LALA peel can provide the environment and states that it can, because they exfoliate those epidermises, they showed a better states of accepting those solutions. So we use less time of numbing cream. So for example, we used 20 minutes on the numbing cream. So for patients with a LALA pill, we use 10 to 15 minutes. And then we do the procedure. And yes, that didn't provide any problem. And because we did have patients were allergic to the numbing cream, it has some of those problems with redness, but it wasn't a big deal because, as you know, the numbing creams are safe itself too, so it was okay. So, and I didn't get that one. Oh, okay. So how many procedures or sessions do I recommend generally, and intervals? Yes. To be honest, I recommend this procedure to take every week interval if they can be. So we have patients, but generally, because as I mentioned, our clinic has a lot of patients, not only because of a LALA pill, but with other lifting procedures or those microneedle injections or fillers or botox. But these those patients are much more high presence, so they come on monthly basis. So if their time allows, I recommend patients to come weekly and get them, but mostly they come on a monthly and they just add this LALA pill and do the procedures. That's a basic routine for the patients in our clinics. Okay. The role of LALA pill for the combination of treatment, as I mentioned before, it just create this environment for the skin to open as so as the role of LALA pill is get rid of those debris and dead skin cells on the top of the skin, so it provides a states is much more acceptable for getting next treatments. So I use often to, because I do a lot of LHA treatment or hydrochloric acid treatments or any other skin boosters on the basis. I do that often, and my clinic is very famous for that matter. So, so we ask patients and recommend them to take these. After using LALA pill, is there a case of acne? Sure, maybe, but to be honest, not really. We didn't have any patients complain about got much more acne because of LALA pill. No, not really. It didn't have any case of that. The reason that I really liked about this product was there was almost none of the side effects. They are very safe and very easy to recommend to the patients to in any skin type of textures and conditions. So yes, we do not have a lot of problems with them. I have one question from yes, from using retinol products. We did have patients using retinol products and tried to do the LALA pill, but for that case, I asked patients not to do the LALA pill because I also felt it was much sensitive to use it, but instead of that, it was okay. And yeah, we didn't do on the patients because we tried to make a very safe procedures. To be honest, not only on retinols, but we had patients, because there are a lot of patients who go around in South Korea. There are a lot of patients go around those clinics and get treatments. We had patients who just did TCA pill, GA pill just the day before and came out to and tried to do a LALA pill. And sometimes they don't even mention about it, but it's one of our procedures, and it has a role. We ask patients that we whether the patients got any treatment beforehand. So we try to pick up those patients who have very sensitive skin states, or very so we try to avoid any side effects. As I mentioned, the great result has to be shown, but any side effects, it would be catastrophic. So we try to avoid any of them. Okay, thank you for the patient, and hope to see you next time. Thank you.